Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to my channel. Let's continue our series of biomechanics of skeletal muscles. But if you have not subscribed to my channel yet, please press the subscribe button and hit the bell icon. In today's episode 5, we will discuss muscle fiber architecture, how muscles are arranged, muscle fibers, and how their structure impact their function. Understanding this will allow you to develop more effective treatment and rehabilitation plans for your patients. Let's start with what is muscle fiber architecture. Muscle fiber architecture refers to the way the fibers in a muscle are arranged. This arrangement affects two major things. Number 1 is the strength of muscle and number 2 is the range of motion. Let's discuss types of muscle fiber arrangement. There are two main types of muscle fiber arrangements. First one is parallel fiber arrangement and second one is pennate fiber arrangement. Let's discuss parallel fiber first. In parallel fiber arrangement, the muscle fibers run in line or parallel to the length of the muscle or axis. This type of architecture allows for greater movement or range of motion. Let's see examples. The sartorius, which is the longest muscle in the body, helps you cross your leg. Second example is the bicep brachii, which flexes your elbow. The bicep brachii that flexes your elbow is another example. When you do a bicep curl, your bicep contract and the fibers shorten, helping you lift the weight. Parallel muscles are great when you need flexibility and mobility. These muscles are responsible for moving body parts through a large range of motion. Let's discuss pennate fiber arrangement. In this arrangement, muscle fibers are angled towards a central tendon, almost like feathers on a bird's wing. As you can see in the picture, this setup allows more fibers to be packed into muscles, increasing the muscle's ability to generate force. There are different kinds of pennate muscles like unipennate. Fibers are angled on one side of the tendon, like in extensor digitorum in your forearm. Bipennate. In this, fibers are angled on both sides of the tendon, like in rectus femoris in your thigh. In multipennate fiber arrangement, fibers are angled in several directions, like in deltoid. Pennate muscles are built for strength, but have a smaller range of motion. So, when you need power, like during a squat or push-up, pennate muscles come into play. Let's see practical implications for physiotherapy. First, start with parallel fiber muscles. These are ideal for improving range of motion. Use exercises that stretch and strengthen muscles like bicep brachii and rectus abdominis for patient needing flexibility. For shoulder rehab, focus on the deltoid's anterior fibers parallel arrangement to enhance mobility. Pennate muscle fibers focus on strength training of the muscles like rectus femoris and gastrocnemius. These muscles are crucial for patients recovering from lower body injuries like after an ACL surgery. In cases where patients need to build power, such as athletes returning to play, exercises targeting the deltoid and quadriceps, having pennate fibers help generate greater force. Rehabilitation planning. Use parallel fibers to improve flexibility and motion in patients recovering from shoulder or arm injuries. For patients regaining leg strength after surgery, pennate muscles like the quadriceps should be the focus for building force. Fiber arrangement and athletic performance. Sprinters benefit from having smaller pennation angle in their muscles, which allows for faster and more explosive movements. Distance runners have larger pennation angle, which helps them maintain force and endurance over long distance. Understanding muscle fiber architecture helps not only in rehabilitation but also in optimizing performance. Here's a quick comparison between these two types of muscle fiber arrangement. Orientation. In parallel fiber arrangement, fibers run parallel to the muscle's length. In pinnate fiber arrangement, fibers attach at an angle to the tendon. Parallel fibers have greater range of motion, but in pinnate fibers, smaller range of motion. Muscles having parallel fibers have less strength compared to pinnate muscles. Pinnate fibers can generate greater force. Parallel fiber muscle examples are sartorius, rectus abdominis, bicep brachii. Pinnate fiber example is rectus femoris, deltoid, gastrocnemius. Parallel fibers are best for flexibility, mobility, and quick movements, and pinnate fibers are best for power, strength, and forceful movements. Muscle fiber architecture plays a big role in how muscle function. Parallel fibers give us mobility, while pinnate fibers give us strength. Understanding this helps us make better decisions when it comes to exercise and rehab planning for our patients. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe.